Working in the intensive care unit, you're going to be having an opportunity to witness various lethal arrhythmias. Patients with VTAC, VFib, SVTs. So the purpose of the skill station is to make you familiar with using the defibrillator. In this skill station, we are going to be learning 3 important features: defibrillation, cardioversion, and pacing. In the intensive care unit, you will find the defibrillator on the crash cart. So if your patient is in any kind of lethal arrhythmia, remember to bring your crash cart into the patient's room. The first 3 rhythms that we are going to be reviewing for defibrillation will be ventricular fibrillation, pulseless ventricular tachycardia, and torsades. Before we go into the rhythms, I would like you to become familiar with the defibrillator and the different features that we have in here. Even if the defibrillator looks different in your unit, if the machine is different, the life pack, the buttons that you see here are going to be the same. So now we're going to start off with, if you look at the screen right here that I'm pointing at number 1, that's the first button that you're going to be turning on when you have to start the defibrillator. So once you turn the defibrillator on, the next thing that you're going to do is connect your defib pads. The defib pads are placed right here on the ziplock that's on the side. Remember, in the hospital, the defib pads are not going to be connected. This will be connected to the power source unit, so disconnect it. Connect your defib pads right here, and once you have connected it, get the 2 sticky pads and place it on the patient's chest. Since we are using this on a mannequin, it looks different, but it does the same thing that the defibrillator pads does in the unit. It has already been marked which one goes to the apex and which one it goes onto the sternum. So all you have to do is to place the defib pads on the patient's chest. Go. So these are the defib pads that we're going to have on the patient. As you see here, it says sternum and apex. So it's going to be the sticky pad. So remember to take off the little backing before you stick it onto the patient's chest. These pads could either be placed on the sternum and the apex, or they could be anterior and posteriorly placed. Once this has been done, we will go back to the defibrillator. So we have placed the defib pads on our patient, but as you can see, we do not see the rhythm up here. And in order to get the rhythm, if you can see the lead button right here, go ahead and press on the leads, and this will let you change to the paddles mode. The moment I hit the paddles, I can see the rhythm up here. So if you do not have time to place the leads which are on the defibrillator, just place the paddles and you will still be able to see the rhythm. But remember to select the paddles on under the lead mode. Next, if the size, next to the lead we have the size. If the size is too big or too small, you may have difficulty identifying the rhythm. So I'm going to go ahead and show you what we can do with the size. So when I press the size button, we get a lot of options. Either we can increase or decrease the size. Now I'm going to use the speed dial that's down here. The speed dial can be used for any of the features to navigate and to change the rhythms. So as you can see, if I'm going up, my rhythm size is increasing, and as I keep going down, it becomes smaller. So you can choose the size that's comfortable to you, and if you're able to identify the rhythm, that's the most important thing. So I'm going to stop right here because I think this rhythm is big enough for you to visualize on the screen. Now going back to the features of the defibrillator. So we have turned it on, we did go to the lead and select the pads, and we did change the size. Next button is energy select. If you are planning to defibrillate, you're going to be using this button. Remember, it has an up arrow and a down arrow. You can only press either up or down. If you try pressing right in the middle, it does not do anything. The third button is charge. So once you select your energy, you're going to charge and shock. When I start demonstrating the skills and the different rhythms, I will be showing you how to use these buttons and how we are going to be demonstrating it to you and how you'll be using it in real life scenario. The next green box that you see right here is for pacing. It has all the buttons that you need for pacing. So once the machine has been turned on, you're going to go to the pacer and you're going to turn on the pacer, select the rate, current, and then your rhythm should start pacing. Now going to the left side of the screen, the first button you see up here is for CPR and analyze. We are not going to use these buttons while in the hospital. This is just for the AED mode, and since you're going to be in the hospitals and your patient is already hooked up to the monitor, we will not be using CPR and analyze. We will use the sync button if we need to cardiovert. So just below the lead and the size, if you can see, we have the sync button, and that will be for cardioversion. So you press the sync button first, then do the energy select, charge, and shock. Just below that is for the blood pressure. If you need to manually inflate the blood pressure cuff, we need to hook up the defibrillator to the patient, but in most scenarios the patient is already hooked up to the monitor in the room, so we don't need to use the NIBP button right here. Alarms, if your defibrillator is alarming, you can use this to silence the alarm. And on the other side of the screen, if you come around onto this side, you can see that we have a 12 lead EKG option. During a code situation, if the physician wants to have a 12 lead EKG done, all you have to do is press the button and it will get printed right here. You will have a 12 lead EKG printed out for you. Also, you can have a code summary printed at the end of the code, and it tells you at what time the patient was shocked and what were the rhythms that were going on during the time. So that's pretty much the buttons and the features of the defibrillator. The leads are usually on the pouch that's on the other side. Remember, you need to have the leads on the patient's chest if you're planning to pace.